Okay, so I'm going to check my orders. I see that I have an order to do a physical assessment on a patient. I'm going to check my allergies and the code status of my patient. Then I'm going to gather my supplies, which is my stethoscope, my pen light, and my gloves. I'm going to enter the room. Hey, I'm Chelsea. I'm your student nurse today. Can you tell me your name and date of birth, please?
Alicia Salisbury, 062291.
Okay, I'm here to do a physical assessment. Is that okay with you?
It is.
Okay, so I'm going to wash my hands. I'm going to apply my gloves. I'm going to provide you some privacy. And during this procedure, it should not cause any pain or discomfort. Pull my curtain. Now I'm going to ask you, are you having any pain today?
No, ma'am.
Okay. Do you have any allergies that you're aware of?
I do.
What are they?
Amoxicillin, penicillin, sulfa, and Invans.
Okay, well, we're not going to be giving you any of those today. That is good to know, and I'll make sure that it's in your records. Now I am going to ask you, do you know where you're at today?
I do.
Do you know the time or the date?
Yep, it's 3:30. It's September 21st, 2019.
Okay, good job. Do you know your height and weight?
5'6", 500 pounds.
Okay, and I did check previously with your vital signs, your blood pressure, your heart rate, your temperature, your O2 levels, and your respirations are within normal ranges. Now that that is taken care of, I'm going to monitor your speech and how you're talking to me, which is clear. You can pronounce your words. You have a very good volume. Okay, so now I'm going to start with I'm going to do a physical assessment on your head. I'm going to get you up into a comfortable position. I'm going to move the bed, but you're on the couch. I'm going to check your scalp. I'm going to be checking for any lumps or masses on your scalp.
Good luck.
Okay. Okay, that's okay. You have no tenderness and no pain on your head, no masses. Okay, now I'm going to check your face. Make sure everything is symmetrical and turn your face towards me. Good job, good job. No rashes, no abnormalities. Okay, now I'm going to check your eyes. If you would, squeeze your eyes tightly for me. Good job. And raise your eyebrows for me. Okay. Now I'm just going to check for pupil restriction with my pen light. Okay. Okay. And they are equal with your eyes to make sure that you have no discharge around your eyes, no swelling. Can you see me pretty well?
I can.
Okay. I'm going to look inside your nose to make sure everything is patent. Can you check your patency? Put one finger and breathe in. Good job. And do the other side for me. Good job. You have a very moist nasal passageway. You don't have any drainage or swelling or discharge. Are you having any sinus problems or anything?
No, ma'am.
Okay, good. Now with your eyeballs, I'm going to go back up there and check accommodation and your peripheral vision. Can you follow my finger? I'm going to go back in. Okay, now we're going to check peripheral vision. So just tell me when you see my finger. Okay, good job. Now this eye?
No.
Good job. Okay, now let's check your mouth. Can I see your teeth, please? You have good dentation. I'm just going to check your gums to make sure everything is intact. No swelling, no soreness. Can I see your tongue and say ah?
Ah.
Good job. Okay. Your mouth seems pretty good. Now I'm going to, now that we've checked your mouth, I'm going to check both of your ears to make sure that they're equal, symmetric. Okay, let me see the other one, please. Okay, you got some nice earrings there. No discharge. Do you have any way of hearing me? Can you hear me all right?
Yes, ma'am.
Oh, okay, good job.
I got my miracle ear in.
Your miracle ear. Don't do that to me. Okay, now I'm going to check your throat. I'm going to check your trachea to make sure that it's intact. Make sure that I can see it. Okay, it's there. Good job. Okay, now I'm going to just check your heart and make sure I can hear the S1 and the S2. Okay, I'm going to listen to your aortic for at least 10 seconds. and this is the pulmonic, tricuspid, and mitral. Okay, and I'm going to listen to each of those for at least 10 seconds. Now I'm going to listen to your breath sounds, if that's okay. I'm going to listen for 6 on the front, both on the side, and then we're going to have you sit up. I'm going to listen to 8 spots on the back, okay?
Okay.
If you would, just take a deep breath for me. Okay. One more. One more. Good job. Good breath. Now I'm going to listen bilaterally. Okay. Alright, good job. Now I'm going to listen to 8 on the back. So if you would, I'm going to assist you to sit up, please. I'm going to listen to 8 spots on the back, and when I instruct you to do so, would you please take a deep breath for me?
Yes, ma'am.
Okay, take a deep breath. Take a deep breath. And again. And again. And again. And again. And again. And one more time. Good job. You've got clear lung sounds. Clear lung sounds. Okay, now that you're sitting up, I'm going to check for masses on the front of your chest and on your back, okay? I'm going to check the back first to make sure you don't have any tenderness. Do you have any pain back here when I'm palpating? Okay, and go ahead and take a deep breath for me. I'm checking to see if both of your lungs expand at the same time. Good job. Now I'm going to check the front to make sure that you don't have any tenderness or masses on the front. And if you would, take a deep breath. Okay, everything seems to be equal. Okay, now I'm just going to check your carotid pulses, and I'm going to do one at a time and not at the same time, okay?
Okay.
I'm just going to do this one. Carotid. Good. You can turn your face toward me just a little bit. Okay, now I'm going to assess your radial and your brachial and your popliteal and your pedal and your tibial, posterior tibial pulses, okay? So I'm going to assess your radial pulses at the same time, and they are bounding and regular. I'm going to assess your brachial pulses. They are bounding and regular. I'm going to assess your popliteal. They are bounding and regular. Your pedal pulses.
You can.
They are bounding and regular. And then your posterior tibial pulses. All right. I'm just going to check the temperature of your skin. Make sure that you have good capillary fills. There's no discoloration. You've got good perfusion going on. You've not got any edema in your feet or your hands. Your feet are a little cold. That might be because y'all have socks on. No swelling. Do you have problems swelling sometimes?
No.
Okay. Your skin sugar looks pretty good. No dehydration going on. Alrighty. Please, I'm going to check your abdomen. When's the last time you had a bowel movement?
About 6 o'clock this morning.
Okay. I'm just going to listen in all 4 quadrants to hear if I can hear any bowel sounds, okay?
Okay. You hear it?
I'm going to palpate all 4 quadrants. Do you have any tenderness or anything?
No.
Okay, I don't feel any masses. Okay. Now I'm going to check your bladder to make sure it's not distended. Okay, do you feel any tenderness when I do that?
Nope, I just got to pee.
Okay, well we can do that as soon as I'm done. Okay, now I'm going to assess the perineal area. I would check groin, the rectum, and the genitalia area to make sure that there's no discharge of that nature or anything like that. Do you have any bruises that you're aware of on your skin, ma'am?
No.
Okay, you don't seem to be dry. Your skin looks very hydrated. Everything looks good. Your toenails are well groomed. Can I see your fingernails, please? They're well groomed. Okay. You don't have any discoloration of the skin, no bruises, any scars, or anything like that. I'm going to check your joints. I'm going to make sure that you have good muscle strength. And I'm also going to check your spine for any abnormalities. Okay, let's do that, please. If you would just lean forward a little bit, I'm just going to take a look at your spine. Okay, it looks like it's good. You can sit back. Okay. Now I'm just going to check the strength of your shoulders and your head. If you would turn your head towards my hand and just press against it. Okay. And do it the other way. Good job. Now do a shrug resistance. Push your shoulders up against my hands. Okay. Now I'm going to check your hands and your elbows and your shoulders once again. If you would just take your hands and do your fingers up like this. Okay, and curl them back in for me. Can you rotate your wrists for me? Okay. Now I want you to bend your elbows in and out. Good job. In and out. And then can you raise your arms up like this for me? Okay, and back down. And then back up and around. Alrighty, seems like those are good. Okay, now if I can get you to squeeze my hands with your hands. Oh, you are strong. Okay, now I'm going to check your feet. I want you to push down on my hands like you're pressing the gas pedal. Okay, do it one more time. Good job. Now I want you to put, I want you to push up on my hands with your feet. Okay, good job. Alrighty. Your feet are working. Can we assess your ankles? If you would, just pull your foot up like this and spin your ankles around for me like that. Turn your ankles in, turn them out. Okay. You don't have any pain when you do that? Okay, now I'm going to assess your hips. Would you like to stay seated and pull your knee up to your chest, or would you like to stand up and check your hips? Whatever's comfortable for you.
And stand up.
Okay, you can stand up. We'll assess your hips. If you would, just copy me and just take your hips out like this. And then take it back. And then bring it forward again. Good, and your balance is good. Let's try the other leg. Take it out, and back, and forward again. Can you take your knee up to your chest? Okay, do the other leg for me. Good job. Now let me see the range of motion of your neck, please. If you would just spin your neck around like this a couple of times, it might feel good. Okay, good. You have good range of motion in all of your joints and with your muscles. And there was no pain caused when you did the range of motion, correct?
Correct.
Okay. Now I'm going to assess your gait, and what I mean by that is I just want you to walk forward 5 steps just like this. And I'm just going to check your balance. Alrighty. And can you walk back for me? Good job. Okay, now you can have a seat, and I'll help you get comfortable back in your bed. So it seems to your physical assessment is completely normal. You don't have anything wrong and no pain of that I know of right now. Now I'm just going to get your bed back in comfortable position. Here's your call light in case you need something. I'm going to remove my gloves, wash my hands, make sure the bed is in the lowest position. If you need anything, please let me know. You can press your call light. Your bed is locked. I've removed my gloves. Wash my hands. And I'm going to leave the room and I'm going to document my physical assessment data.
Thank you.
Yeah.